Hi, I'm Tara Crawford, and this is From Lab to Life, where we dive into deep discussions with researchers from the Martha S. Pitzer Center for Women, Children, and Youth here at The Ohio State College of Nursing. Today, we're joined by Drs. Patricia Williams, Barbara Warren, Holly Jones, Mackenzie Jansura, and Shannon Gillespie, all who's ready to discuss why what they do is relevant from lab to life. Let's get into the conversation. Hello.
Hi, how are you?
I'm well. How are you?
Good, thank you.
Good. Well, first and foremost, thank you so much for your time. I'm so excited to connect and learn more about your experiences, so thank you. Before we get started, I'll start our conversation off by asking each of you a very quick round-robin question, and then from there I'll ask each of you individual questions as it pertains to your career and experiences, okay? All right, so the first question is a fun question, and the question is, in 90 seconds or less, can you summarize what you do and what you are most proud of as it pertains to your career? Who wants to go first?
Go first, it's fine, you know. One of the things that I think I've been able to do with my career, doing it, and the thing I'm most proud of, is to be able to put together the idea of academic work with clinical work. And I think that has been important for me because it has helped me to stay vibrant in both of those areas, the writing, the research, the academic part, the teaching, but also the clinical component of what I do, which helps me to enact the evidence-based practices and to be able to then to kind of look at the women that I'm having in my practice and see where they are, gauging what's really in real life for me. So I've been proud to have that, be able to do that.
That's intriguing. Thank you.
You're welcome.
Perfect. Well, I'll go next. I don't know how I can follow that. That was pretty good. So I've been thinking about this, and it was quite a long time ago that I was learning how to be a maternal infant nurse. And at the same time in my family, my mom was actually dying. So it was a really interesting juxtaposition. And I remember having moments in time where I just thought to myself, I need something good to come from this. I need to pour myself into something and help people who are struggling in healthcare and with illness. And so I've been able to do that. And now we're finally being able to kind of see things progressively moving towards doing things better, taking better care of people and saving lives. And I do that now as a nurse scientist, also in academia, mentoring students and just being present in the healthcare field. And I'm honored to have that opportunity. So very proud of that. Very proud of nursing as a profession as well.
It's inspiring. Thank you so much for sharing something so sensitive like that and utilizing that as in a sense, a spear to get you to where you are today. So thank you.
Sure, yeah, thank you.
Good. Well, I guess it's if we're going around, then I guess I'm next, huh? Well, one of the things that I do as a director for the Martha S. Pitzer Center for Women, Children, and Youth, I lead faculty. And that means that we have to try to keep them motivated and the different resources that they need. So I hopefully provide that to them. And I conduct research myself. And I conduct research that empowers women. And I do it in the area of breast and cervical cancer prevention and control, as well as looking at the intersection of cancer, survivorship, and cardiovascular disease. And what I'm most proud of is that I developed instruments called cancer literacy assessment tools. And they have been translated into Spanish, into Arabic, into Somali, and into Mandarin in Chinese. And I often get requests, from international requests for the instruments. So I'm really pleased that I've been an instrument for those functional cancer literacy assessment tools.
I would say it's safe to say that your work is instrumental.
It is. It has been. Thank you.
Thank you.
All right. Well, I'm next then. And I have focused my work on midlife women And what have found clinically and in research is that midlife is often absent, and midlife women, in particular midlife Black women, are often underrepresented in research. So I focus on the health disparities that occurred during that time. And what I've been most proud of is that I have been able to develop a culturally tailored intervention with midlife Black women from the community. And that has been it is intended to mitigate the effects of chronic stress on the morbidity and mortality associated with heart disease.
Well, I just appreciate you being a voice for the underrepresented, and I think that everything you're doing is very important, so thank you.
I guess I'll round things off. So my research looks a lot at how we can improve the health of moms before they become pregnant, during pregnancy, and then in those initial years after they give birth. And I do that to try to prevent pregnancy complications as well as prevent the cardiovascular disease that can happen after a woman has experienced a pregnancy complication. I look a lot at inflammation pathways and how our behaviors and also our exposures, both environmental exposures or social determinants of health, can influence inflammation pathways and contribute to complications. And I think one of the things I'm most proud of is I've been able to combine two worlds of health behaviors and immunology. These are not two places that are frequently in the same space, but by combining kind of applications from both places, we can really drive the science forward. And I think I've been able to really show what nursing science can do and move it really all the way from bench to bedside, which I'm really passionate about.
I really like what you just said about going from bench to bedside. That's very important. I think that a lot of everyday women who may not be in research can benefit from everything that you're doing. Similar to you, Dr. Warren, when you mentioned about the clinical and academia, I think that's equally as important as well. So thank you all so much for sharing. It's been very eye-opening for me personally, so thank you. So as I mentioned, I would like to ask each of you several questions, and you all have given me more and more questions to ask, but in the interest of time, I'm going to try to be mindful and keep my passion down and stick to just asking a few questions. And so my first question is for you, Dr. Williams. You mentioned you are the executive director, and I would actually add the inaugural executive director of the Martha S. Pitzer Center for Women, Children, and Youth. And so my question for you as the leader, how do you see the center playing a particularly vital role in advancing the overall health of women and children and youth?
Well, we have our faculty are really energized, and they're committed faculty, and they don't do research for research's sake, but they do research to make a difference, and that's what they do. They make a difference in the lives of women, children, and youth. They do that by designing various types of interventions. And those interventions are practical. They're used in the hospital settings. They're used in the community settings. And so they are involved in research across the research continuum, just like Dr. Jensura said, from bench to bedside and even to community or barrio, and then back again. So we do translational research, and then we also want to make sure that the research is sustained. So our faculty are working with policy. That might mean policy in the hospital setting. It could be policy in the community setting, but we're moving the needle, and that's the exciting thing about what goes on. And our faculty they not only commit to doing the research but then they're doing service, and so they are also working with different agencies and volunteering their time. They're sitting on boards, and so we are an example of the land-grant university, of what the land-grant mission has. We in the Pitzer Center are a wonderful example for that.